Welcome back to Local 3 News. It's Aspirus Medical Monday, and joining us via video chat is Dr. Douglas Tice, an orthopedic surgeon with Aspirus. Today we are talking about sprain tips for knees and hips. And so why is it important to talk about this time of year?
That seems to be the greatest and common denominator visit that we see, especially when spring starts to come around and people start to get involved in activity again and running and different sports-related type things. You know, the knees start to bother you, your shoulders start to bother you, hips are achy and sore, and so most people are trying to clear out the cobwebs that have accumulated during the winter months.
How do you keep these joints healthy?
We should all be involved in year-round exercise activities, stretching. For lack of a better way to say it, as one of my old professors used to say, motion is lotion for the joints. And so it keeps us mobile, it's good for the body, and it's also good for the mind and soul.
What is the cause of pain or injury in these joints?
Probably the biggest source of injury for folks is a lack of just basic stretching for the back and for the hamstrings and the quadriceps and the Achilles tendon. So a good stretching program is extremely important every day, both before and after exercise.
What are other factors in having healthy joints?
Obviously, ideal weight is probably one of the most important things, and from that comes basic regular exercise and a good nutritional program. So staying away from the drive-through and eating healthy and eating appropriate portions too. So probably one of the most important things long-term, especially as we get older, is having an appropriate weight.
When should people seek more medical help?
When you have pain out of proportion to findings, so in other words, things just don't get better. Everybody's pulled a muscle, everybody's had a sore shoulder, most people have a sore foot or ankle. When those things aren't improving and they're not getting better with the usual things that you do, a little bit of ice, maybe perhaps an anti-inflammatory, some rest, swelling out of proportion to what it should be, really warrants you to kind of look in the mirror and say, maybe perhaps I might want to ask somebody a question about this.